So we have a crisis within a crisis happening at the border. As I'm sure all of you know at this point, there have been a number of children who have died within the past year because of poor attention and poor care at the border. And now we learn this. Yahoo News spoke to 5 doctors, including Russell and Griffin, who volunteer at shelters and clinics on the border, and each confirmed that they regularly see migrants with chronic conditions like diabetes, asthma, seizures, and high blood pressure, for which they claim to have had medication that was confiscated while they were in custody of U.S. Customs and Border Protection and neither returned nor replaced. It happens more frequently to adults who are more likely to be on such medications in the first place, but doctors said they've been hearing similar reports from increasing numbers of children or their parents. For these doctors, all of whom are pediatricians, the seizing of medications heightens concerns about the medical care provided to the record number of children held at processing centers and short-term holding facilities along the southwest border. So they're confiscating medicine, which is probably leading to some of the stories that we've seen of people dying as a result of various medical problems, and then trying to cover it up too. Their argument is, it depends on who you talk to. Some people at the Border Patrol just lie and say, we're not doing that. And others say, yeah, we're doing that, but what the fuck, like, what else would you have us do? What are you going to have? Somebody cross the border with a bag of pills and then you say, go right ahead? They think it's like smuggling drugs into the country. So they want to stop it, and that's why they confiscate it. But what I don't get is, why don't they have doctors or pharmacists who know these drugs and just look at what kind of drug it is? So if somebody's bringing in, blood pressure medication, seizure medication, diabetes medication, nobody's partying with diabetes meds or seizure meds or high blood pressure meds. You know when you stumble across something that might be smuggling in drugs, like somebody's smuggling in fucking anti-anxiety pills. But even then, maybe they have an anxiety disorder. But okay, putting that aside, you know what might raise a red flag, and 90% of medications are not going to raise a red flag. Maybe you have the 10% that do, whether it be anti-anxiety medication or pain medication, opiates, opioids, so on and so forth. Like, that might raise a little bit of a red flag, in which case you could do a little more digging and researching to see what the deal is, to see if it makes sense to confiscate the pills. But in this case, with a lot of the types of medication that are being brought in, nobody's partying with that shit. Nobody's smuggling that in. They're taking it because it's their medication and they need it. So this is unfortunately what's happening now. And time again, we see these stories that really illuminate how cruel the treatment is at the border. And it's not a lot to ask for, to have a basic process in place and to show basic humanity to people. And, I don't think that's an unreasonable demand, and I think the majority of the American people would agree with those things. But unfortunately, more and more now, we're seeing the opposite occurring. So they should definitely change the policy around this, but I doubt they will. Listen, again, all it would take is, at each facility, you have to have one doctor or one pharmacist that can tell you what kind of pill it is, and then you could take appropriate action. As opposed to what they're doing now, which is, some of the border people are lying about it, and others are saying, yeah, we're confiscating it, but what the fuck else would you have us do? That's a system that's going to lead to more deaths and more disaster. And in the article, they explain how, other doctors explain how, when I met with many of the people, I ran tests on them, and many of them did have, like, high blood pressure again. Why? Because of the fact that they took their fucking high blood pressure medication, of course. So they shouldn't do that. So they really need to change the policies, but I doubt they will, because it's very similar to what happens with prisoners, which is, people have this thing in their mind where they go, well, I mean, they're prisoners, so that's going to be the first thing I'm worried about, is how prisoners are being treated. It seems like something is put on the back burner because there's so many other problems affecting non-prisoners that you're not going to go to, well, what about the prisoners? In this case, I feel like it's a similar thing, where it's like, well, they broke the law coming in here, so, like, maybe they deserve what they have coming to them. Do you really deserve to die of a fucking seizure or a heart attack because you didn't get, your blood pressure medication. They confiscated it, and it just seems so fucked up, and it's just such an easy, quick fix, but I doubt they'll do it. In fact, I almost know they won't do it, and it's a shame. And these are going to continue to be people who get the least amount of sympathy in society, and certainly on an issue like this, they deserve quite a bit of sympathy.